We want to welcome you to this panel discussion with our expert speakers. This session for nurses focuses on the care of the self and the importance of self-care in nursing to maintain a healthy nursing workforce. The concept of self-care, we will soon find out, has been widely researched and written about. My own personal bias is towards relationship-based care because the concept of self-care appears within a relationship-based theory, which is an evidence-based model that helps to create a healing environment in healthcare organizations. And one of these key components of this is that the relationship with oneself is just as important as the relationship with everybody else. And so, without any further ado, let me introduce our esteemed panel members. Our first is Dr. Wilfred McSherry. He's a professor of nursing in the Department of Nursing School of Health, Science and Wellbeing in Staffordshire University, England, United Kingdom. He has held joint appointments with the University Hospitals of North Midlands NHS Trust in Staffordshire and was part-time professor at Vid University College in Bergen, Norway. He's had a long career spanning over 30 years focusing on advocating dignity, spirituality, especially in the care of older people and those receiving end-of-life care. Of course, like all our other authors, published extensively. Welcome. Dr. Pamela Cohn. Do you have a problem? Louder? Yes. Louder. All right, for you. Dr. Pamela Cohn, with a PhD, is a professor emerite and a US Fulbright scholar, graduate of and doctoral nursing programs at School of Nursing, Azusa Pacific University in Azusa, California. She was born and raised in Haiti with missionary parents and has been a nurse for 47 years and a nurse educator for 31. She has taught courses in theory and research, international health, spirituality, and she works with both master's and PhD students. Welcome, Pam, expert.
Thank you.
Dr. Matthew George is a dentist by profession who, along with his wife Lata, a dentist too, worked at a rural mission hospital in India from 1993 to 2013. From 2013 to 2019, he was with the Evangelical Medical Fellowship of India, heading its missions department. Presently, he heads a ministry called Compassion of Grace that seeks to challenge, teach, and empower healthcare professionals to be on mission. Welcome, friend. And finally, my dear friend, Tova Giske, a professor of nursing at the Institute of Nursing at Vid Specialty University in Bergen, Norway. She's a registered nurse with both her master's and her PhD, and she enjoys teaching, doing research, and collaborating with nurse educators and researchers from various countries. She has published extensively, taught internationally, and presented her work in many countries. A very talented nurse educator. Welcome. I have some questions for the panel. I will ask the questions and then ask them to individually answer as whoever wants to jump in first. So my first question is, what drew you into this area of self-care? What was the impetus that drove you to be involved in self-care? Take it away, whoever wants to go first.
Well, I will go first. I was in my master's program, and I was asked to teach a course on nursing theory and another course on family theory and another course on stress theory and management. These were my first classes. They were the classes nobody else wanted to teach. In my exploration about stress theory and management, I came across information and evidence on the importance of self-care. So I started teaching that in the classroom, just what I was reading. And it became something that I was asked to speak about in local hospitals. And then, eventually, I met Tova, and we were both interested in not only spiritual care, but self-care. So that was the beginning of our journey.
Thank you. Who wants to go next?
I think it was... Can you hear? Yeah. It was just during the pandemic when I came across quite a few of those who had mentored as medical students and nursing students, and now were facing the pandemic personally. I realized that they were going through a lot of stress, yet they had to continue working. And as I asked them, is there anyone who comes alongside you to care for you? They said no. How about you? Have you found mechanisms of caring for yourself? No. And it brought to my mind of how when I was working both in the clinical area as well as in administration, of the stresses that I had to face. And there's no one who would come alongside me. And at the same time, being a medical healthcare professional, I thought I can take care of everything because I take care of people. And in the end, I never did take care of myself. And I realized that there were situations when I experienced burnout or I burnt out at other people. And so I realized that there was a need for a mechanism or a program or a way to care for myself. And then this whole aspect of, you said, a relational theory, I realized that self-care is in the context of a caring community and a culture of caring within the healthcare team and the healthcare context.
Thank you.
Yeah, I can say, since I was a newly graduated nurse, I have had a lot of interest and have been engaged in much work. So for me, unconsciously and consciously, it has been to find the balance that you never find, but you know when it's too much or too little. So I have been not using the word self-care, but I've been more thinking I have to, I can't drain too much on myself without having kind of to be filled up. That's more how I thought. And then my personality is so that I get filled up by being together with people. So we are very different in that way. So, for example, going to conferences like this, it's a lot of work, but I'm so happy. It fills me up. So it's this finding the balance, yeah. And also, over the years, to learn how do my body speak, and to respect the body. So I know for myself, when I get, it's too much, I know how it feels. I often get tired in my back, for example. So then I know, this is a sign, better self-care. It's either sleeping more, saying more no, walking slower when I get back from work, or things like that. So for me, I more talk about balance of giving and receiving, and knowing when the body speaks to me. Yeah.
Firstly, I'd like to thank everyone for the invitation to come to the conference. It's my first NCFI conference, so it's wonderful to be. I'm slightly delayed, but better late than never. And I'm just looking at the picture up there. Perhaps my self-care hasn't been good. I might have to share a more up-to-date picture, and perhaps that's a picture of my twin, but I'll say a bit more about that. Self-care isn't selfish care. That's my philosophy. And it's about how do we treat others with dignity and respect, but how do we treat ourselves with dignity? And part of that is being compassionate. And I think for me, we cannot give to other people what we don't possess ourselves. So as Tove has just said, that charging oneself, being aware of when you are running low in terms of your energy and your emotional well-being. So I think that's vital importance. And for me, I love being in nature. I'm a beekeeper. So for me, being with my bees is a good distraction.
Great answers from everybody. Thank you. So can you give us some examples or experiences of self-care that you experienced or somebody else experienced that was very important, that created resilience in them? Or examples of people that didn't know how to do this?
I will share something that maybe is funny. I thought it was hilarious at the time. I was teaching these students stress theory and management, and I emphasized how terribly important stress self-care was because, as Wolf said, you cannot give what you do not have. So if you don't have enough strength or courage, you cannot give. So I was in class at Azusa Pacific with a whole group of nurses, and I was reminding them how important it was to take care of themselves. I had just finished a discussion about laughter and how important they should include things in their life that gave them joy and made them laugh. And suddenly, a huge rainstorm, monsoon downpour came. And this one-story building became a box of noise. And I thought, how am I going to teach? So I shouted, I would love to have a cup of tea and a blanket and a good book in this rainstorm. And they all looked at me like, no. And one brave student says, I would like to go out and play in the rain. And the whole class was like, yes! So we did. And I said, okay, everybody has to do that. Everybody went out, and I was with the students, and we played in the rain. And the rain was so heavy, we could jump into huge puddles that were already formed after 10 minutes of rain. And I realized one student was not with the group. And I said, okay, it's enough now. You're going to have to go to next class. That means I have to send you to your rooms, your dormitory rooms, so you can dry off and get dry clothes. So I herded them all in, and one student had not gone out. I had missed it. And I said, what's the matter? You did not go out. I'm practicing self-care. I do not want to get a cold. I gave her credit for self-care.
Great story.
I can share a story that is not funny. I have been fortunate to work in a very, you can read in the literature, conducive environment, which means an environment that is supporting you, where you can grow, where you are appreciated. And that has been the kind of air I've been breathing in. I'm very fortunate. So then there was some change in leadership. And I felt belittled, overlooked, put down, invisible. And it hit me so hard. It was terrible. It was like I didn't understand what was happening. It was the last thing I thought about in the evening when I got to sleep. And it was the first thing I thought of in the morning. And then you know it's a lot of stress. I was devastated. I cried. I mean, it was like I didn't understand what was happening or why it was happening. We sometimes call this use of power. Often, we women can say that men use that kind of power for women. But this was a women leader, so I couldn't use that excuse. My husband said, "You have to find another job." And I said, "I've been there for so long, I love this job." So I prayed and kind of hang in there. So prayer and guidance, talking with a few friends about the situation. And then I realized I have to take care of myself in this situation. So others were kind of supporting me. And I said, I'm a grown-up woman. I should set some boundaries for myself. I need to develop some skills and say, this is not okay. I hadn't needed to do that because the environment didn't require that of me. Another thing was, it's okay as a Christian to name how I experienced the situation. And it's okay as a Christian to own my own experience, even though it was caused by somebody else. I struggled a little with that. So then I had to think about, so I work in an organization, so something you try to handle yourself. But this was something that was relational, and it was in a system. So I've been thinking about how do we use the systems when somebody is badly treated. So I mean, is self-care just what I do for myself, or is it also relational or organizational? And I think it is. And another thing I read in the epic book we have written is that self-care on kind of a general prevention is something. When you are in an acute, terrible state, as I found myself, self-care is different. You have to do different measures just to sleep and to rest and to do your work. And then self-care in rehabilitation also is something else. So I found that very helpful to think as kind of prevention, as acute care, or rehabilitation. Yeah.
It's interesting. Here it comes. It's interesting that Pam mentioned storms. I think she sent it to Frankfurt on Wednesday evening when I was travelling here, and Frankfurt was shut down, so there was self-care needed that night. But I've already said we can't give to others what we don't possess ourselves, and I remember as a newly qualified nurse, one of the situations that ignited my passion around spirituality, human dignity, was a cardiac arrest situation. I won't go into all of it. But at the end of this, what I would term now was a critical incident, the charge nurse, the ward manager who was on duty that evening, came up to me after I'd spent about 8 hours, nearly 7 or 8 hours with this person, this dying gentleman and his wife. And they came up to me and said, "Wilf, That's a wonderful learning experience. Go into the staff room and make yourself a cup of tea. It was self-care. Was that self-care? I don't know. But that started me to reflect on the importance of clinical supervision, the importance of debriefing in clinical environments which are very challenging and emotionally and spiritually. And sometimes we've the entire world's just come through a pandemic, and there are a lot of people who are feeling this situation at the moment, as you've identified. So how do we continue to preserve, to promote, and to safeguard them as well as ourselves? And perhaps, that go and have yourself a couple of minutes and a cup of tea seems quite ridiculous, but in a way that was a defence mechanism, a coping mechanism to say, just step out of that situation for a moment and recharge, re-find yourself. Because I used to find working in clinical practice, most of the self-care happened on ward nights out, and perhaps some of the strategies there weren't healthy and not as good for our well-being as they should have been.
Two stories, and two stories come to my mind. One is with a family or a friend. My friend's father was diagnosed with cancer, and all his children were in the medical field. And he knew that it's going to be a stressful period in the months to come, because there was both a chemotherapy as well as the radiotherapy. And he knew that most of them, the children and his wife, would undergo stress. So he just called his wife and his children and he said, let's do one thing. Let's all go to Goa. Goa is a part of our country where there are beautiful beaches. It's like Malaga, okay? It's better than Malaga, okay? And he said, let's celebrate life. Let's celebrate the 60 plus years of what God has given to me and to us, because I know that in the next few months after that, we all will go through stress, but we begin with a positive approach to the whole thing and prepare ourselves. And of course, he didn't live for too long, but his daughter later talked to both of us and said, what we did that time was so caring by my dad. He did not only care for himself, but for him, self-care was included caring for his family and bringing them into part of caring as a community, and knowing that when he leaves a family that's less stressed. The second is a more hilarious one. Unfortunately, there are people called alcoholics and also workaholics. I belong to the second category of things. And I tend to sleep only very late in the night. And it's not a pleasant thing to have a daughter who's working in Alzheimer's and dementia. And so every time she calls me at around 1 o'clock in the night to see if I'm awake. And so this happened for quite a few weeks. And she said, Dad, this is what's going to happen in your brain, and this is what's going to happen in your, in you as a person. And I still did not get it. And then I land up where she is after a long 24-hour journey, along with my wife. And she says, you're looking exhausted. I said, no, it's just a jet lag. And I've got to get up tomorrow morning because I have a meeting coming up. She said, okay, go, fine. You still do not get it. Next day when I wake up, it's 12 o'clock in the afternoon. What she had done is she'd gone into my phone and removed all the alarms. And so I said, this is 12 o'clock, and no alarms rang. He said, you need to care for yourself. And it begins with me. I'm so glad I've got a daughter who cares for me, and I'm also looking forward in a few days, and on Sunday, I'll be reaching there and make sure that I switch off all the alarms. But why I said this is, sometimes we do not care for ourselves, and it's good to have others who will come in and ensure or bring in mechanisms that you care for yourself. Thank you.
Kamalini? I would like to share just one brief thing. Is during that time when I was teaching a lot of classes and I was just learning to be a teacher, my husband normally would get between 4 and 6 weeks vacation. We decided to take 4 weeks and drive across the United States. We had a wonderful time, and I thought, this is so good, stress reduction. I'm having fun with my family. The children were great. We came back, we just were so refreshed and renewed, and went right back into my heavy work schedule. And like 2 weeks later, I was exhausted. And that is when I clued in to the fact that self-care needed to be regular. I needed to get refreshment and renewal somehow, not just the once-a-year vacation. That isn't enough. Stress accumulates. Stress reduction lets you release that, but it doesn't hold on. It's gone when it has renewed you and refreshed you. It's done. It did its job, and now your stress is building up again. So that is when, and that was in the middle 90s, that is when I realized I got to do this regularly. And I began gathering funny movies, funny comic strips from the newspaper, books. My husband loves reading all kinds of weird books, and some of them are the jokes. I made him get us clean jokes so that I would be laughing and not going. And I started keeping track of the things that gave me joy. I put on my refrigerator the funny pictures of my kids that made me laugh. So that when I went into the kitchen to cook dinner, I would just be laughing. Oh, I remember when my kid did that, and it was hilarious, and we just laughed, and it made me laugh all over again. And that was part of my self-care. So I realized that self-care needs to be ongoing. It's not a once-in-a-year thing.
Saying that because after that event of my alarms being switched off, I thought that's the best way is to have some people make me accountable whether I'm doing self-care. And so right now, I've moved from sleeping at 2 o'clock in the night to sleeping at 12 o'clock early in the night. It's a good progress for me. But both my wife and myself keep me my daughter keep me accountable. And I think self-care also does, therefore, for people like me who are very stubborn self-care, careless people, I think we need a mechanism where accountability, and there are people who will help you care for yourself.
Am I on? Yeah. Thank you for those stories. And for those of you who are nurse leaders in the room, do you even stop to think that your nurses, your staff nurses need care? I remember I was a leader when the shift changed from 8 hours to 12 hours, and that took such a toll on the nurses. And so I thought to myself, how can I help these nurses? So I decided that from 1 to 2:30, we would not allow visitors in the hospital. We'll dim all the lights, we'll close all the doors. Everyone has to speak in a whisper. Nurses have to sit at the station with tea or coffee, and nobody could disturb them. They just loved it. And we continue that practice, and they realize we need a shh time, they used to say. And so I would encourage you, find ways to give care to your nurses, because they are not empowered sometimes to do it themselves. Thank you. Another question I didn't really ask is, how good are nurses at self-care? Right, but as a whole, as a profession, if a nurse can take time out to go to the bathroom, she thinks she's had self-care.
Yeah.
Really, because they just keep working and working, or not working and just standing around. I don't know.
And there's something with the nature of our work
Yeah.
that is holistic. So that means every aspect is kind of a part of our care. So if the dietitian is not there, if the physiotherapy is not there, everybody is not there, it's still part of what we think about, the patient needs. So it's very, very challenging to set boundaries, as we were reminded of on the first keynote we have. So I think when we focus on person-centered care, holistic care, we also need to discuss what are our boundaries, because it can be endless. And I come from a country where we have the highest staffing in the world, and our nurses complain. So when I compare with what it means to be a nurse in some of the African countries, let's say we have 7 nurses per 1,000 inhabitants. In Sierra Leone, they have 0.4 per 1,000 inhabitants. Well, our healthcare is very different. The expectation from the public is very different. So there's a lot of differences. But, if we speak about holistic and person-centered care in every country, and the conditions are so different, and also the idea of supporting. I remember I was at a conference in Ghana some years ago, and I shared an article about the responsibility of leaders. And they looked at me, and what planet do you come from? Do you think our leaders are supporting us? Yeah, I thought that was the idea. Leaders should support. And I said, you don't understand our working conditions. So, there are so many differences in nursing, so it's challenging to talk about what self-care means. Yeah, so I think our nursing bodies, we have to lift it from an individual perspective also to some organizational, as your story was about, because there are some conditions I myself cannot do anything with, and you can feel helpless. Yeah. So we have to discuss this and to find ways, to what is my responsibility, what is my power.
So if you do have the power, use it. And if you don't, find ways to take care of yourself that is acceptable within the institution or
I remember being approached by a publisher to write a book on caring, principles of caring. And we edited this book. There was 3 editors on the book. And I remember reflecting on the content of each of the chapters. And I suddenly thought, we had a discussion as editors, and the first chapter we wrote was definitions of care and caring. And then in our discussions, it soon came to mind that if we were asking others to care and to be caring, then the next chapter had to be on self-care. Because what we argued was there was no point in going beyond those chapters into the rest of the material without having focused on our own self-care, because the rest of it would never happen, or not to the degree that it should happen. So every single book now, I've been involved with that around the principles of caring. There's always a chapter on self-care, because it is fundamental.
We have 10 minutes left, and I'm going to ask you to please share what challenges do you see ahead in nursing that relate to self-care? What challenges do we yet have to face?
Reflecting on my country, and probably this issue is a big impact on other countries, and I'll probably say a bit more of this at my in my keynote on Sunday. But I think the biggest challenge we face at the moment around self-care is our nursing workforce. There aren't enough nurses, and that's internationally we find it. I won't say too much because I'll spoil it for Sunday.
Well, I think along with the workforce just being not enough, I think we have maybe a handicap from our background that we are a caring person, kind, compassionate, maybe we'll be allowing others to walk all over us. And that's okay because maybe we're Christian and we're going to let them know that we're being kind and compassionate. I don't mean that we mustn't be kind and compassionate. Absolutely, those are nursing values. But we sometimes confuse that idea with the letting someone treat us badly. And so, as Tova was saying that she had been treated badly, and this was the first time, it was terrible, and at first she didn't know what to do. So a lot of you may have that thing. We are nurses, therefore we always care for others, but every time I fly, I'm reminded. That's why the flight attendants tell us, put on your oxygen mask first, or you may not have oxygen to save your child or someone else beside you. So we need that oxygen. I think we have a huge challenge of defining the difference between self-care and selfishness. So self-care, Wilf said, it's not selfish. It is actually an act of love. Don't you think it more loving to come to work rested, to make sure we're eating right, sleeping right, getting the good nutrition, getting our exercise, and doing things that will bring us joy and inner strength? It is more loving for our patients and our peers for us to do that self-care than to neglect it.
Yeah, I think there are so many different levels in this. So on the personal level, I mean, for myself, I think to know my sources of refreshment, to know my body, and at my age, I should know it. You who are young might be excused for not knowing it yet. But as we grow, that's a part of the wisdom. We are responsible to take care of ourselves. Sometimes we remind ourselves that Paul says our body is a temple. So we should respect the different limitations we have. So you know all about eating and sleeping and exercise and also spiritual, the prayer, fellowship, reading God's word and all this. But there also is something interesting. We sometimes discuss different generations. So I don't think we have got this generation zero, is that what they call them, the youngest one, into our nursing education yet. But you know, the generation X and Y and all these things with different characteristics. So I think, and it looks like around the world, the young ones are more alike now. So it's a little bit less difference between some individualized cultures, where there are some ways of taking care of yourself, and more community-based cultures. I think they have other resources, yeah. I mean, we discuss for our students, are they able to focus, to study? Are they able to kind of move from being self-absorbed to be focused on others. So there are so many elements in this that is impacting how we take care of ourselves. But I also think it's very important to not just think of self-care as an individual thing. It is also, we have to kind of challenge our organizations and our leaders. So what are the expectations? How do they kind of treat nurses so it's possible? Yeah, the expectations of double shifts, or you're not doing good enough job, or I mean all these accusations from outside also. Yeah, so with leadership. And then again, this prevention, acute treatment and rehabilitation in healthcare, in self-care, I think is important.
I think the challenge comes in three areas. One is the individual. I mean, it's all said, and it's good to understand we need self-care. And self-care is also in the context where you can express the need to be cared for. But unfortunately, there's a mindset across healthcare workers that if I share my struggles, will I be considered as incompetent, as somebody who's not able to manage things, and so how can he or she manage patients? And also the fact that if I share my struggles, people are going to look at me differently and I lose value and face. And so that's why very so often people within a context of a care team do not share their struggles. I've experienced it. And I'm sure many of you would be experiencing that. And so to get out of that mindset is going to be a challenge, because it requires humility and vulnerability. And healthcare workers are not very famous for that. The second is the area of peer-to-peer. The best way of bringing care is to bring a culture of care within the team. That's where you have your influence and you have your ability to make a change. But that requires courage to bring in a culture of caring within your team. As you said, switch the lights off and do certain things, or hush time. It requires courage. And that's something very so often when we find it difficult to bring up courage in a strongly hierarchical culture like healthcare. Wow. The third one is in the institutional level. And there's a whole talk about respite care culture, institutions giving people time off officially to take care of themselves. It was something that was there earlier, but it's becoming less and less and less. And HR policy is also making it more and more difficult. So the thing is, how do we bring these? These are the challenges that are going to come. And now there's a new phenomenon called dry promotion. You get promoted in your position, but no money and nothing that is there, and you continue to work. And they think that the person who accepts dry promotion is the most efficient worker. And so we got a culture within the organization. Those are going to be the challenges, and we need God's grace for overcoming those.
I wish this could have been questions and answers, but our time is gone, and our president is itching to come up here.
Thank you so much for sharing of your experiences, as well as your knowledge as having been in healthcare and research and work for many years, actually. We have a well-experienced panel up here. I think we all know that self-care, I heard a lot of claps and resonance because we recognize in ourselves that importance, but that it's not self as an individual. There's an aspect of that, but it also self as a community. And hopefully, again, during these few days, we will practice self-care by caring for and encouraging, praying for, supporting one another. So, as a small token of our thanks for sharing now and hopefully on Huva and in conversations onward, we'd like to just give you a small gift. CARES, Reflections for Nurses.